pleased with the turnout, the responsiveness, the respectfulness in which Roanoke County discussed this COVID conversation today. There's a number of good ideas that came out of there, things we've got to go back and work on, but also the spirit of it, I think, really engages the community to look locally and say, what more can we do in our schools and our community to drive the vaccination rate up? And so we're going to take this and we're going to go to more communities and more rural areas in Arkansas and have the same message and listen in the same way. And I think this has been very important. It's been helpful to me and our health department, and we'll be looking at a number of ideas there. One of the things that was mentioned was support for businesses that are now struggling to make their workplace safe again and bring workers back. We talked about the specificity of our advertising to make sure we're answering the questions that people really are worried about. So a number of things that we're going to be working on.
Governor, I have a question. So Missouri has asked for federal aid. Is Arkansas going to do the same thing for COVID-19 increase in cases?
We will ask for any help that's available to us. We've had a conversation with CDC and the White House, and they've offered surge teams and different ways to help us. And so we've agreed on some areas that they can help us. The conclusion we both reached was we have vaccines that are out there, they're available to everyone, so that's not the need, and it's not in testing resources. So it's really the demand issue that we have, and we're working with them on ideas and ways that they can support us on that. But we're open to any help, and we've had that conversation.
You've heard from a number of people today about the concerns with rural communities and the distribution of information. In addition to these community talks, are you going to change your plan in terms of getting the information out there?
Yes, we are. That was one of the important questions that were asked. The point that was made is that not everybody has access to the internet. Not everybody watches the TV news. And so the information flows in a different way. And so community health organizations, other charity organizations that are working with low-income individuals, they need printed material. And so we're going to have to increase our supply of printed material that answers these questions, and that was important information tonight.
Some people... Go ahead.
Well, there was one thing that I learned when I was a kid. Do you remember, you've got to bookmobiles when you were a kid? Because I lived in rural Louisiana. They would come to your neighborhoods a lot of the time. Is that a possibility with inoculation mobiles that would actually just come to specified neighborhoods I heard y'all talking about if you ask us, we'll come, but.
Well, I mean, first of all, the goal is so that it is already in every neighborhood. It's in their doctor's offices, it's in their clinics, it's in the nurse practitioner's office. We want to make it available in that way. But yes, we also have mobile vaccination clinics that are available. We've sent them out a number of times in which there's been very little response. And so, but it is available, and that's a tool that we can use when the demand is there.
The people that aren't concerned about COVID-19 and are just living their lives normally probably aren't going to come to something like this. Is there any efforts to reach those people?
Well, the key is through the employers, and that's why they're really critical, because the workers go in there every day. They're working with other co-workers there, and so if the employers give them paid time off so that they can go get a vaccine, or they ask us to bring in a clinic and partner with a provider that can give shots right there in the workplace, that's accessible. And then if they have questions, we'll make a healthcare professional available so they can go in and answer questions. Employers really are one of the keys to getting information out, accessibility, and also giving them paid time off.
With the number of cases that we're seeing too, especially over 1,000 in the past 2 days, is there any plans of maybe more restrictions or mask mandates in the future?
No, as I said, everybody knows what needs to be done. Get a vaccine. That cures everything in terms of being able to go to work, stop worrying about getting COVID or do I wear a mask. Let's just simply get the vaccine. We're not looking at additional mandates. We're looking at individuals making the right decision. Thank you all very much.